My background and specialty is that I actually grew up here in East Tennessee in Cosby, and I went to the University of Tennessee, Knoxville for my undergraduate. Then I did medical school in Johnson City at ETSU. And then I moved all the way down to New Orleans and did my residency in OBGYN there at Charity Hospital at Tulane School of Medicine. And then I've been back in Knoxville for about 18 years now. And recently, over the last 6 or 8 years, I've just done GYN. I quit delivering babies. My experience with Results Physiotherapy as a patient and a provider has been fabulous. As a provider, I can refer patients there that have pelvic pain. A lot of patients come in with pelvic pain and they've had CT scans, ultrasounds, and all kinds of tests trying to figure out what's wrong with them. At this point, I do a very detailed pelvic exam, and I'm able to elicit the symptoms that they're having just by pressing on a certain nerve, ligament, or bone. And then when I elicit that response in the patient and they go, yes, that's the pain I've been having, I feel really good because I know that I can refer them to Results Physiotherapy and they will be taken care of. When I identify these patients, all I have to do is fill out a sheet, fax that and their demos to Results Physiotherapy, and they call the patient, get the patient set up, and it makes it super easy on me and the patient. The types of patients that I refer to Results Physiotherapy are a lot of times my more difficult patients. I have older patients that aren't candidates for surgery, but they need something done, and those are excellent patients to send to Results Physiotherapy. They really get benefit from the urinary incontinence and fecal incontinence. And then, like I said, the pelvic pain patient, the one that's been everywhere, nobody can figure it out. Results Physiotherapy has helped my patient population enormously. I had one patient that I had actually done surgery on for pelvic pain, and then it didn't work. And so I sent her to Results Physiotherapy. She came back to me and says, I thought you were crazy when you told me to go to physical therapy for this pelvic pain. I thought you just out of your mind. But I went because I trust you and I was willing to try anything. And she goes, and it worked. She goes, it was awesome. Just after the first couple weeks, she started getting relief. And then after that, she still has to go back occasionally if it starts acting up, but we know what it is and know it can be fixed. What I say to my patients that are a little skeptical about Results Physiotherapy, they look at me like I'm crazy sometimes. It's like physical therapy, and a lot of them think that physical therapy is like if you have a knee and you're out in front of everybody and you're just working in the middle of a room. I have to reassure them, no, it's in a private room and with one therapist, and that give it a try. You've tried everything else. And I like to tell them the results that I've had personally as a patient and as a physician, that it really works if they will just try it. I said, just go once. If you hate it,